Good morning. Today is Wednesday, March 25th. I'm giving you the day because some of the information you get may have changed by the time you see this, but it's relevant information and you need to know what the dates are. So today is Wednesday, March 25th. I'm Lawrence Tony Haygood, as many of you know, Mayor of the City of Tuskegee. I'm meeting with some of our leadership team at the city. Mr. Roberts is our consultant and past city manager. Mr. Long, who's with Utilities Board, Ms. Clark, City Clerk, and Ms. Ortiz, who's working with us in community development and planning. Chief Frazier's getting information for the community. The reason we're putting this out at this time is I needed to update the community as to where we are regarding the coronavirus situation. And so we wanted to share some information at this time. Also, I just got off the phone, a conference call with the governor's leadership team, which they provided to members of the Alabama League of Municipalities executive group. I'm a member of the executive committee with the Alabama League of Municipalities, so they gave us an update from their top people on the governor's staff. First thing that I want to say, and this was on the TV this morning on the Today Show, the coronavirus is very, very serious. It's expanding tremendously. Some governors have shut down their states and said to stay in place. They had a gentleman on, Dr. Craig Spencer, this morning on Today's Show, who was one of the key doctors in the Ebola virus when it was in Africa. It got way, way out of hand. And the thing that he said, he got the Ebola virus working with people in Africa during that time. And he said that it is real. He said that he was in the hospital with the Ebola virus and he was able to come out of it, fortunately. And he's trying to work with the coronavirus in America. He said that the Ebola virus was tough and they had a lot of problems. He said the coronavirus is much more tougher. It's much tougher. It's much more challenging for the medical community and for the world at large. And he quoted, said, people saying it isn't real. He said it is. He said they said it isn't bad. He said it's really bad. And he said it isn't a challenge. He said it's much more challenging than we can anticipate. So that's coming from one of your top doctors worldwide who work with the Ebola virus, who's speaking about the coronavirus in America. And he reminded us to stay home. He said, stay safe and try to be well. As was announced today, Prince Charles was announced that he has the coronavirus. Tom Hanks has had the coronavirus and his wife, entertainers. Major athletes have had the coronavirus. So it's hitting a lot of people. It's not discriminating about who it hits. So anyone who's exposed can potentially get the coronavirus, and that's how serious it is. Now I'm going to talk in a scattered way because coming off the conference call we had several leaders from the state health department, state law enforcement agency, the governor's chief of staff, the head of the Alabama League of Municipalities, superintendent of the schools, who all spoke to us on the conference call. And so I'll try to give you the highlights of my notes very quickly so that you can understand it. The first thing we went over was a person out of Washington, D.C. As you know, last night, which was Tuesday night, the Senate and finally passed a bill which will give some assistance regarding coronavirus. The representative on the phone who works for the league, works for us in Washington, was trying to give us some information about what was coming out. But there will be certain tax credits for employers. They're trying to strengthen the bond market so that that stabilizes. You're going to have huge numbers of dollars coming out. Now, what does that mean? We'll get to sort it out and find out how much each city potentially can get, or each county, what the states will get, what the hospitals get. There's going to be money put in all kind of places because the virus is affecting everything, health care, law enforcement, all the way down the line. Key thing that I want to remind everyone, remind ourselves here at the city and at the Utilities Board, Mr. Roberts, Mr. Long, to keep any receipts. What they said is to document how it's impacted you in terms of anything we've had to spend, including law enforcement that had to do extra duty, anything that's impacted us in terms of revenue that we normally would have. Say if we normally have $60,000 in the category this month, but all of a sudden this year, because of coronavirus, we only able to get $20,000. We need to document we had a $40,000 shortfall from taxes that normally come from restaurants in Tuskegee or something like that. So they want us to document as much as we can, but the bill will potentially provide some relief in different areas. They don't know what the final bill is. and we're fighting to make sure the money comes directly to the cities. They don't want to come into the state, Mr. Rob. They don't want to come into the counties. They said keep all that separate. Send it directly to the cities. And the other key battle is they don't want to come in loans. They want to come in grants. They want to come in grants so we don't have to worry about paying it back and that kind of battle. They said this situation that put everybody in the challenge was not a situation that we should have to pay back on, because it's an unexpected situation that has our cities off track. So that's the highlight of that. There's a lot more details that I won't go into, but there's money going to be coming to individuals as well. Right now, instead of $1,000, they're talking about even $1,200 per individual. And they say that they should have something over the next 2 weeks or so. So sometime in April, if that's actually going to happen for individuals, you should be getting notification. How they are going to do it, we don't know. We don't have the answer. So please don't call us right now. We don't have the direct answers. But we're going to try to help do all we can from the city side, working with the county, working with the utilities board and other agencies to make sure that the citizens get the information they need so they can get the reimbursements that they're qualified for. There'll be access to emergency funds. That's Senator Schuler, who's a minority leader in the Senate, is trying to extend the unemployment benefits 4 months beyond what is normal. So right now they expect it to even go more than what is normal for those who are going to have to file for unemployment. You have as much as $10 billion for small businesses in their emergency guide. You have $30 billion in disaster relief. You have retention of tax credits and different things relating to student loans. So all those are brought out from Washington, D.C. Now more locally, one of the key things that we're looking at is how do we prepare for the situation in Alabama. The people who were on the phone was Joe Bonner, who was the governor's chief of staff, David Scott, who's the state health officer, Brian Hastings, who's head of the Alabama Emergency Management Agency, Hal Taylor, head of Alabama Law Enforcement Agency, Aaliyah, Steve Marshall, the Alabama Attorney General, and Eric Mackey, the State Superintendent of Education. As I was saying, one of the things that's already happened in the city of Birmingham, they've gone to shelter in place. That means you're not supposed to be out unless you're on vital business, essential business only. Well, right now that may come under challenge because the state wants to say they don't know if the city of Birmingham had authority to do that. But that came from Birmingham City Council and the Birmingham Mayor. The City Council had to pass an ordinance. And there's some sensitivity in Alabama about authority, but that's something that we feel as cities, and as a mayor, I'll say the city should have authority to decide that. Because people sitting in the other area can't tell you what's going on in your area, what's best for your area. My difficulty with that is you want to say whether or not someone can decide what's best for their community, but we don't have the preparation for this virus. They've already indicated they don't have enough ventilators at this point. We don't have enough masks, personal protection equipment for our healthcare providers. We don't have enough tests yet. And yet you're going to tell local officials how they should decide about protection. Birmingham went to that, and I know that Councilman Hilliard and the mayor there, Woodfin, decided on it because they had so many cases of people in ventilators in UAB. And the number of cases rising in Birmingham right now is over 100. This morning, while I was on the call, the first thing we got, there were 242 cases in Alabama. The call was less than an hour. Before we got off the call, the state health officer said there's 293 cases, and it's reaching 100 in Jefferson County alone. So they will have to make adjustments related to this, and what we do in this city will be dependent on what we find out. The other thing that was mentioned is that wherever they do testing, all of a sudden the numbers jump. So just because we don't have a known case in Macon County right now, and some of our other counties, because a lot of testing may not have been done. And I know we've had some people that asked about testing. We've sent them over to the test sites either in Montgomery or Elmore County. We've had 1 or 2 people who've called. And I will give you that number. I should have it here so that they can go and get tested, those who need testing. That number is going to be 888-264-2256. 888-264-2256. If you feel ill in any kind of way or abnormally, call and let them set you up for a test. The person that contacted me last week. I gave them the number. They called the next morning. They were able to get an appointment, and they got resolved. So right now they told them they're on hold just to shelter in place till they get final results. But so far they seem to be okay. But they said they did respond to that number, and they assigned them to Elmo County. They had a choice to go to Elmo County or Lee County. So anyone who suspects anyone is sick, please call that number to get testing done. The guidelines that they're giving us. So I'm reading from two different things. This guideline says no gatherings of large groups, parties, churches, no other group. That specifically says it here. Gatherings should not be in small rooms. They say right now it's just too dangerous to have gatherings. And I know a lot of people want to have churches, but they say if church meetings are meeting more than 25 people, local law enforcement can issue a warning or charge a misdemeanor. Remember, the overall goal is to protect the public. This came out yesterday from Dr. McIntyre. Additional items today, the Emergency Management Director reminding us that while we're in the midst of a coronavirus, we had a tornado in North Alabama last night. And he said, so he reminds everyone we're in the midst of tornado season. And the reason that's important to consider, because he said if you talk about people having to go to shelters, you're putting people in a close environment, very, very close, in a closed environment. So he said, please follow your local officials and ask local officials to think about that if they get warnings of potential tornadoes are coming in the area. How do you put people in the best place safely without putting us under more danger related to the coronavirus? Because anytime you put people close together, they're finding out that it's spreading. That's what keeps coming on the national news. People talk about the cities who were very effective, not only in this virus, but some previous viruses that they had in the country. They said those cities that sheltered in place, even for a limited time, had a much lower rate of infection than the cities who let everything continue to go on. One of the reasons they think New York has such a high rate because so many people travel by the subway. They're in close contact, they're in close quarters, and they get infected by touching things that the next people come along and touch. Because it's going to stay on those surfaces for a period of time. Our policies have to be sensitive to the supply chain, to grocery stores. So if we put policies in place, Mr. Roberts, we have to think about if we say that we shut down the city, we still have to have a way that people can go to grocery stores or to pharmacies, those essential places. We have to have guidelines, and we have to let law enforcement know that if that becomes necessary, we still have to recognize that. One quote that was expressed during the call, they said that everywhere we look for this disease, where testing is available, we found it, and the numbers go up. So Dr. Scott Harris of the State Health Department reminds us, just because we don't have it right now, that we need to be just very, very cautious in how we respond and very thoughtful in what we do. And that's the key thing about this virus. It's invisible. You don't think about it. It doesn't seem like it's here. And then all of a sudden you hear the numbers going up somewhere. You hear about people having to go to the hospital. So we want to remind everyone, to remind others to be careful about this. Now, ALEA, Alabama Law Enforcement Agency, stated that they still have the law enforcement driver's license offices open at 35 of the 73 locations in the state. Not all of them, but 35 of those offices are still open. They're still doing the STAR ID because there was originally an October 1st deadline. That deadline for STAR ID has been extended by the President, order of the President, by executive order, but he hasn't given a new deadline. So it's not as pressing as it was in the past. So people don't have to worry about running if your driver's license is going to expire and you don't have the STAR ID and you need to travel after October 1st. They're going to extend that deadline several months. So there's no need to rush. Attorney General has asked everyone to voluntarily comply with what law enforcement is adhering in terms of the group gatherings, in terms of whatever the local officials come out with. They're trying to ask everyone to voluntarily comply. He said, but they don't, Chief Frazier. They said that law enforcement is authorized to do what is necessary to keep people safe. And that's coming from the Attorney General. The other thing that he mentioned was price gouging is not allowed. If people are charging more than 25% of what's normally charged for a product that's necessary or needed, or people see that they need or desire, what do you call them, sanitation products, wipes and disinfectants, masks, anything. If they charge more than 25%, that's a violation. We can contact the consumer agency at the state, or we can contact the Attorney General's office, because that's considered price gouging and they're subject to severe penalties. Other key thing that was mentioned, Dr. Mackey, the state superintendent, which was probably the biggest thing that was mentioned before the end of the call, is this afternoon Dr. Mackey will meet with the governor, and they will come to some decision between this afternoon, which is Wednesday afternoon, and Monday, as to whether school will be canceled for the rest of the year. Now, let me say clearly, I'm not saying it will, and he said it there, but he did say that they're having to look at all options. And he's meeting with the governor this afternoon because the superintendents of the local county systems and city systems asked to be notified by next Monday, because before the 6th of April, and they said they needed at least a week to know whether to prepare to come back. There is possibility that school may be canceled. Some of our colleges are already canceled. I've heard that the university, our local university, is not coming back this semester. That was the last I heard. I don't have it official. So when I don't have something official, I'm going to tell you I just heard some information from reasonable sources. So you need to check into that. But as far as schools, public school system, Dr. Mackey is meeting with state superintendents, meet with the governor today, and they will put out something between today and Monday, possibly as early as Thursday or Friday, about whether school will continue this year. And if they don't, they're going to make preparations to help everyone finish their work and how graduation will be held so nobody's denied graduation. It's a complicated situation, but there's something they're working out. But understand this, that's there because this is so serious. They're not going to just call off a situation such as school when you got something this serious going on. When you have something such as this serious going on, when you call off school session, that means it's super serious. And that's what we're facing now. They're looking at, if you don't have any other option, they have to do what's necessary. You're bringing people together, and what they're going to go by is what could impact the state. See, the most serious thing that's happening is when you don't have enough supplies, and that's what they're afraid of in Birmingham. That's why they went to shelter. The hospitals are running over with people. They don't have the supplies for the healthcare people. And the key thing, as the governor of New York said, you got to have ventilators. If you don't have those in the hospital, then you can have a lot of people who may not make it through if they get sick. And that's a major concern. And we can't overwhelm the healthcare system, because if not, we'll do like in Spain, which unfortunately, those of you who may have seen it on national TV, Spain has people laying in the hallways, on the floor, on a mat. They're just laying them down, and you wait in the hallway until they can get some bedroom space to put you on. That's how overwhelmed they are in Spain. So these decisions that people are making are very necessary because it's very, very serious. We want everybody to take it seriously. And the most important thing that I can say from what we're doing is to try to help each other. You got to check on the elderly. If you have a problem with utilities, we want people to pay utilities. Everything has to continue to operate. If you're getting paid, you're on your job, regularly pay utilities. If you have a problem, call Mr. Long or call the utilities office and someone will work with you. But we're not saying do not pay utilities. We don't want to give that idea at all. We need people to pay the utilities. The system has operated like any other system, like you pay any other bill. If you're working, continue to do what you normally do in terms of your bills, because there will come a time for some who aren't working, and you don't want to be super behind because you stopped too early. So do what you can. If you run into a problem you can't handle it, call someone, and we'll try to get you some assistance, and we'll see what your situation is. Same thing with the city. We're still carrying out city services. If you contact us, you cannot come in the building, but we can make arrangements to connect with you if you call to the city and get whatever needs to be handled. You have utility business, come to the drive-through. They'll take care of utility business in the drive-through. The key thing that we're asking is that you put out good information. I appreciate Deputy Chief Leon Frazier for sharing this information with us, because we have a lot of people putting out misinformation. We do not have tests in Macon County right now, unfortunately. Those test centers were designated from the state level. Originally they had 22, they may have more now, but we don't have it in Macon County. So when they put out the rumor just before I came here, oh, we have tests in Macon County, They said they heard a rumor. I said, well, if you heard a rumor, if you can show me where they are, let me know. But we went to a meeting the other day. We didn't have any tests in Macon County. We can help people find out where to go to be tested. But right now, to my knowledge, as of Wednesday, we don't have any in Macon County. Numbers we have county by county: Otago's 1, Baldwin 4, Calhoun 2, Chambers 7, Cullman 3, Elmore 9, Franklin 1, Houston 1, Jackson 2, Jefferson 99, which is right at 100, Lamar County 1, Lauderdale 6, Lee County is up to all the way at 29. So those going to Lee County, be very, very careful. They see if you go to the store, go in the store, have your list, so you go in and get what you got to get and come on out. Wear your gloves. If you got any kind of mask, wear them. Don't touch those handles without something on your hands. Limestone 6, Madison's up to 21, that's Huntsville. Marion 1, Mobile 10, Montgomery now is up to 9, Morgan 2, Pickens 1, Pike 1, Shelby 36, St. Clair 5, Talladega 4, Tallapoosa 3, Tuscaloosa 10, Walker 8, and Washington 1. Alabama now has, and this says 242, but now it's up to 293, the latest. Fortunately, we don't have any in Macon County that we know of at this point, but it's very possible that we could. We hope not. But if we practice social distancing, it's not just a term. I know it's a new term that's come up, and you're going to hear it a lot. But the social distancing means staying apart. Recommended distance is 6 feet. I tell people I'm very serious. I say 10 feet. 10 feet. I say it with a smile because he's 6 feet. I said, everybody wants to say 6, I'm going to say 10. But if you put in an extra 3 or 4 feet, then you're more than likely not to get infected by anything in the air, because it can travel in the air in droplets when people cough, even when they're talking. If they blurt out, those droplets of air can contain germs. So we don't know who has it. We've had people, we found out yesterday, we had an employee who traveled out of town, been out of the country, so we're asking them not to come back to work for 14 days or more. We've had some people who travel, we've shut down stuff at our local airfield. They voluntarily shut down, and we appreciate that, because they had them, some of them were flying, and they said they don't want to take a chance, so we're shutting down some of that activity. But we just want people to know that we're going to do the best we can, the most we can for our community, to be safe, to do what's necessary, and it may rub some feathers the wrong way or get some people upset, but we're going to do what we can to protect this community. We don't have any choice. We don't need to be talking about after the fact, oh, if we had done it, we might not have lost somebody, or it might not have spread so bad. What we want to do is do everything we can to try to prevent it from spreading and try to prevent losing anybody to the extent that we can. We're not in control. That's not in our hands. We're thankful that we're not. God's in control, but He asks us to use good sense and use best judgment we can in any situation, particularly in a situation such as a crisis that we're facing now. This is not a local crisis. It's not a national crisis. This is a worldwide pandemic. Just turn on your TV and you see the crisis going on everywhere. The numbers are scary in some places, especially in Italy, where you have 600 died in one day. Now, we don't need 6 dying here. We don't need 5 or 6 getting sick here. If we do what we're supposed to do, hopefully we'll be safe. I think we'll be safe. And so we're going to ask everybody to try to comply with the protocols and the suggestions. And if you have any ideas, let us know. I mean, it might be something we're not doing that you could suggest. Get as much fluids as you can, stay hydrated, but keep your health up. Get sleep. Now, it's not time to stay up all night watching TV and get your resistance down. Get more sleep than you normally get. I'm getting an extra hour or so now. I usually stay up half the night. I don't do that anymore because I can't afford to let my resistance get down and get sick. I don't plan to put myself in that position, and I suggest no one else does. The best way to do is to keep your resistance up. Get you enough sleep. And when you get under stress and pressure, because you're around somebody you're not used to being around all day now, because a lot more people at home, and a lot of children at home, step outside and take a breather, get some fresh air, go do some exercise, let somebody else handle the children or something so you get a break. Because we're going to have a stressful time coming here. Most important thing that they keep reminding us, and thank you, Chief Frazier, wash your hands regularly. I mean, I'm washing my hands 4, 5, 6 times or more a day. Whenever I go somewhere and touch something, I come back washing my hands.
And get make sure that children do it too.
Make sure your children wash their hands. And wipe down anything that you can. If you're in your car, you're going to get gas, get you a napkin, if you don't, paper towel or something, put on that pump. Or if you got to use a pump, as soon as you get back, wash your hands or wipe your hands off. It's transmitted by touching surfaces, and to the extent that we can protect ourselves, let's do that. That's most of what I have right now. Are there any questions, any comments from anyone else here?
We realize that some of our customers will be negatively impacted by this pandemic. If you are impacted, we would appreciate you giving us a call so that we can work with you to make sure that your utilities continue. We'll do everything within our power to make sure that you at least have your electric and water services still running during this time. We are not able to issue a blanket statement that no one has to pay because we are a small utility, but we know that some portion of our community is low income and may not have the resources to weather this storm, and our goal is to work with you in any way we can to make sure that we all get beyond this point and come out on the other side. Hopefully this is not going to be something that is long term. I'm happy to know that Congress has worked together to come up with a packet, a bill that is going to put money into the community. There's going to be money that's coming down to individuals that should help a lot of our customers during this time to pay their utilities once this money starts flowing. So if you're having any issues, contact our customer service department and we'll work with you in any way we can.
To the things that you do, washing your hands, if you have the capabilities, if you have to check your temperature, make sure you're not in the position of feeling bad or having anything that related to the symptoms that would cause concern. And if you do, make sure you use the number that was given before, the 188 number 264-2256, and make sure you abide by the protocol that's been laid out by the governor's office.
Okay, thank you, Mr. Roberts. Our city clerk, Ms. Clark, anything you want to add or share, anything you recognize?
No, just want to stress the fact that you need to wash your hands. Constantly wash your hands. Do not touch your face, and do not come in contact with someone where you're sneezing, and because I've learned that this virus can be transmitted through the droplets. So be careful with sneezing and coughing, and make sure you have at least 6 to 10 feet of distance between you and the next person, and stay at home. Please stay at home so everyone can remain safe.
Okay, thank you. Ms. Clark, city clerk, and Ms. Ortiz, who's joined our team and is working in city planning. Anything you want to share?
I just want to say, please maintain that social distancing. I think that is important, in addition to what my colleagues have mentioned here today. Of course, a cautionary measure can help stop the spread of the virus, maintaining that 6 to 10 feet of social distancing. And as we mentioned, recognizing gatherings, no gatherings of more than 25. And please, as was mentioned, please wash your hands. Maintain that as well.
Okay, I want to thank the clerk and Ms. Ortiz, both worked with Mr. Roberts and Mr. Owens, our city manager, to develop our response to the coronavirus thus far. We'll get more information from the city regarding what our next steps are. So just listen out for what we need to do, but we need everyone to practice as much as they can staying at home. When you turn your TV on, you're going to find out in all the major cities, in several states, they're telling people to stay at home, do not come out. The reason is you're going to contact people when you go out. Even if you don't contact people, you're likely to contact the germs where people have been before you got there. And that's why they're saying stay at home. Home gives you the safest place to be. And I know that's hard for some people to do when you're used to going out, when you're used to being with people and doing things. But we're talking about safety and your future, and the future of your family and your children. If you've seen some of these people going through coronavirus, and they've interviewed some of them who went through it, it's an extremely difficult situation, even when the people survive it. And we know a lot of people can survive it, but it's a very difficult situation that you don't want to experience. None of us want to experience. So please practice staying at home as much as possible. We'll try to share any information with you that we can. Based on information today, please listen out for updates. This is from Wednesday morning. They're going to have better information Wednesday afternoon, Thursday, Friday. So whenever you hear this, go back and get the latest information. Listen out for what the superintendent of education says, and let's make the adjustments that are necessary. Thank you for your efforts. Call us if you need us for anything, and please be safe, protect your families, and let's all work together and get through this period. Thank you.